Hi, my name is Hannah, and I'm a member of the Dr. Zhang Lab. I'm going to do a short overview of my lab's research and introduce the project I am working on. So my lab is a cancer research lab, and one of the cancer types we work on is lung cancer. Lung cancer is the second most common cancer in the United States. And there are two main types of lung cancer, but non-small cell lung cancer, NSCLC, makes up 80% of lung cancer cases. And this is the type of lung cancer that is not associated with smoking. So we have several treatment options for lung cancer, but one of the newer treatment categories is immunotherapy. Immunotherapy is the utilization of the immune system to identify and attack cancer cells. One of the proteins my lab works on is programmed death ligand 1, PD-L1. And PD-L1 is highly expressed in non-small cell lung cancer cells. The cancer cells use PD-L1 to hide from the immune system. So one type of immunotherapy focuses on blocking PD-L1 from working so immune cells are able to attack cancer cells. These therapeutics are called anti-PD-L1 therapeutics. And while these are effective, the medications often have high rates of side effects, such as chest pain, shortness of breath, and stomach pain. And this is due to the high dosages needed to be effective. So how do anti-PD-L1 therapeutics actually work? Well, immune cells have a receptor called programmed cell death protein 1, PD-1, on the outside of the cell that binds to PD-L1, which is on the cancer cell. When these two proteins bind to each other, it tells the immune system that the cell it is bound to is safe and is a normal cell. This interaction is an immune checkpoint. Cancer cells that express a high level of PD-L1, such as non-small cell lung cancer, have this interaction frequently, so the immune cells cannot identify the cancer cell as being an abnormal cell that needs to be destroyed. This is evasion of the immune system. Anti-PD-L1 therapeutics work by introducing an antibody that binds to the PD-L1 protein on the cancer cells, preventing the immune cell from being able to interact with PD-L1. And with this interaction blocked, the immune system is able to identify the cancer cell as a hazard and kill it. This prevents the cancer cells from evading the immune system. So, as mentioned, anti-PD-L1 therapeutics work well, but have high rates of side effects. To lower the rate of side effects, I want to be able to improve the ability of the drugs to work at lower dosages. To do this, I'm exploring combination therapies. Combination therapy is the usage of two or more treatments that together work better to address an issue than they do alone. The other main goal of my research is to understand how immune cells are activated to promote immune cells heading to the location of cancer cells. If I can recruit immune cells to the site of cancer cells and stop the cancer cells from concealing themselves from the immune system, then I have a more efficient treatment for cancer which can lower the necessary dosages of medications. This would lower the rate of side effects while maintaining the same or higher rate of killing cancer cells than when using a high dosage of anti-PD-L1 therapeutics. Thank you for listening to my overview of my research, and thank you to the Dr. Zhang Lab for their support, and this presentation was created with BioRender.